Tonight we're continuing our coverage of the healthcare systems being used in countries all around the world. And tonight we're going to report on the quality of care in communist China. We thought it would be interesting, given all of the discussion that surrounds and the focus and interest in China, even though it is not a developed nation, to focus on what passes for healthcare in the nation's most, in the world's most populous nation. Consumer satisfaction in China. The words almost don't go together, do they? But it hasn't been widely measured, as you might expect. One 2009 study, however, reporting that public satisfaction with China's healthcare system is low. The system is reportedly rife as well with corruption. Life expectancy in China is 73 years. China is now struggling to reform its public healthcare system. We thought we might learn something just by looking in on them. Kitty Pilgrim with our report.
For a Chinese citizen, get sick and you will also likely get fleeced. Chinese public hospitals and clinics charge patients as much as they can in out-of-pocket fees. William Shao studied healthcare systems around the world for 20 years.
It's like a cash machine on the backs of the patients. And they're trying to generate as much revenue as they can for the hospital, and then that's divided up between the hospital and the physicians and other staff in the hospital. They try to do as much as they can, order the most expensive drugs, overprescribe drugs, order more tests than that's necessary, keep the patients in there longer, so they can generate this revenue.
9 out of 10 Chinese have some kind of government-run health insurance, but it doesn't cover much. At least 60% of healthcare expenses are still paid out of pocket. The quality of care is uneven. Many doctors don't have the sort of training required in Western countries, according to Drew Thompson, director of China Studies at the Nixon Center.
Only about a third of medical practitioners who are called doctors have a 4-year degree. That means that 2/3 have essentially a community college type 2-year education or just a high school education or something technical training. A lot of guys wearing white coats, but I wouldn't want my family to see them.
Public dissatisfaction has sometimes led to violence. Thompson cites a 2008 study by the Chinese Ministry of Health that recorded 9,800 attacks on doctors and hospitals, resulting in $26 million in damages. Mei Chang, an Asian healthcare expert, agrees there is conflict over healthcare.
Basically, the patient-doctor relations is pretty tense. And I think that, you know, it can be explained by the fact that the out-of-pocket spending is very, very high, and people are just desperate. They're driven to desperation.
The government spends 4.5% of GDP on health care, compared to 16% in the United States. But China is spending $125 billion over the next 3 years on new hospitals and providing far greater access to health care, especially in rural areas. Now, under recently announced reforms, the Chinese government says it wants to cover 90% of the population with significant health care insurance over the next 2 years. China is also trying to move away from the current payment system, but the government is meeting resistance from the doctors and the hospitals that benefit from the fee structure as it stands now. Lou?
I have to believe most people are surprised at your report, expecting perhaps quite a different result when we talk about communist China. Compare it to Cuba's medical system, its healthcare system, which is absolutely stellar.
Yeah, it is kind of a surprise. You expect a paternalistic sort of communist system, and it's anything but.
All right. I'm not sure what we're going to learn from that or from some of the others, but it's a fascinating glimpse into what other people are thinking and doing, and perhaps it'll be ultimately cumulatively important in our debate and discussion on healthcare legislation in this country, should it ever come to actual legislation. Thank you very much, Kitty Pilgrim.